Assalamu alaikum. So my rudimentary next topic is regarding the muscles of the facial expression. These is what we look alike when we do not have our skin or epidermis on our surface. So whoever have a beautiful skin, so there is no need to even miswatch, no need to boost about their skin types, because this is what we look all alike same without our epidermis. Apart from these activities, so we have the muscles of facial expression. First of all, we have orbicularis oculi. Orbicularis oculi is the main muscle that is responsible for closing of the eyelids. So whenever we close our eyelid, it should be remain in our mind that orbicularis oculi is responsible for closing of eyelids. Next we have orbicularis oris. Orbicularis oris is the main muscle of lips. It is used for different purposes, for to express our emotions in terms of different things, etc. I think so we are better now, so there is no need to explain about it. Then we have occipito frontalis. Occipito frontalis has two heads, that is anterior belly and posterior belly. The anterior belly of occipito frontalis is not attached to the bone. ओसिपिटो फ्रंटालिस की जो एंटीरियर वैली है ये बोन के साथ अटैच नहीं है. इट इज़ अटैच टू एपिक्वेनियल एपोन्यूरोसिस. द पॉइंट टू बी नोटेड कि जो पोस्टीरियर वैली है इट इज़ अटैच टू द ओसिपिटल बोन, but the anterior belly is attached to epicranial aponeurosis. So anterior belly plays an important role. That is, whenever we move our eyelids superiorly, that result in wrinkling of the skin. It is usually caused by occipito frontalis. So in any situation that ultimately leads to gazing, or we can say that surprising movement, we actually wrinkle, and that wrinkling is caused by occipito frontalis. And that's the eyeball seems to be that the person is exophthalmos, hyperthyroidism. Maybe that person is studying in Avicenna Medical College, so that's why hyperthyroidism involved. Next we have buccinator, masseter and the buccinator. These are the muscles of mastication that are responsible for mastication and chewing process in our mouth. Masseter and buccinator. Next we got that, so these are the levator, levi, palpebrae, superioris. Levator, levi, palpebrae, superioris. And that we have procerus muscle. This is a transverse and this is a vertical. Now there are the muscles that are mainly responsible for the facial expression. These muscles are zygomaticus major, depressor anguli oris, levator zygomaticus minor, and that is risorius. The muscle that is responsible for happiness or smiling is the zygomaticus major. That is, this is the main muscle that is responsible for I should clear it so that we can have a clear view. This is the main muscle that is responsible for happiness, zygomaticus major, and the depressor anguli oris is responsible for grief. When we have a grief or sad movement, that mostly happens in Avicenna Medical and Dental College, so our depressor anguli oris usually work alone, I should say. So these are the main muscles of facial expression, and these are the muscles that are also related to the depressor. This is a mentalis muscle that is attached to the mental foramen. It do not have that kind of purpose, and this is depressor levi inferioris. It works with the depressor levi, depressor anguli oris, depressor levi inferioris to cause grief, and that here we come the platysma. It's a muscle, but it's actually a thin sheet of the flat muscle that are attached to the anterior surface of the medial half of the clavicle, and the platysma muscle and the muscles of the facial expression is usually supplied by the facial nerve. That is, they are usually supplied by the branches of the facial, and that's